There's a variety of situations that we might use medication for. One of the situations might be if someone is already doing therapy, having some success with cognitive behavioral therapy, but maybe they're not progressing as far or as fast as they would like, or that might be best for them, so we might add medication in that circumstance. Sometimes there isn't availability of cognitive behavioral therapy or any therapists in an area, or it's not accessible for one reason or another, and so medication is a way that we can provide some treatment in those situations where therapy is not readily available. Sometimes people are not able to start a course of psychotherapy until their anxiety is relieved somewhat, and so we might start with medication sort of to prime the pump, so to speak, or to grease the wheels of change and make it possible for someone to be able to make best use of cognitive behavioral therapy. So parents often want to know how long their child is going to be on medications. Well, the first thing really as part of that answer is the medication working? So obviously we want to make sure that the medication works. It takes a minimum of a couple of weeks and really up to 3 months to really evaluate what the full benefit of the medication might be. And so first of all, we have to establish that it's going to work. So once the medication is working, then sort of the rule of thumb is that we would want the youth to be on the medication for a minimum of 6 months, and then anywhere up to a year or 2 that they might remain on the medication. Whenever we start medications on children, our idea isn't we want them on for the rest of their lives. A lot of parents are very concerned about, I don't want my child to be on medication for the rest of their life kind of thing. And that's not the position of physicians, certainly not the position of child psychiatrists. We want it to be a tool in order to help them to overcome, ideally, their anxiety. And so we might, as I say, want to continue the medication for a year or 2. And really the sign that we would start reducing the medication is that they've been anxiety-free or relatively anxiety-free, but our expectation is a significant reduction.
Cognitive behavior therapy is an approach to anxiety that gets a person to look at their thoughts about their worries and their fears, as well as their behaviors of avoidance, and also looks at ways that they can learn to calm their body reactions to anxiety. It's important to remember that problems with anxiety aren't solved overnight. However, there are lots of resources out there to help children and the adults who care for them overcome their struggles with anxiety.